Hey Fanshawe, the video that you're about to watch covers topics about sexually transmitted infections and testing at the Middlesex-London Health Unit. If you're feeling impacted by any of the information that you hear in the video today, we encourage you to look after yourself in the best way that you know how, but you can also contact the Counseling and Accessibility Services Office. The information is located in the caption. Stay safe, Fanshawe.
Hi Fanshawe, my name's Leah and I'm the gender-based violence counselor here at the college. Today on this episode of FSU Asks, we're lucky to have Darryl with us from the Middlesex-London Health Unit. How's it going?
Good, how are you doing today?
Good. Yeah. So Darryl actually works with the sexual health team, and Darryl's gonna talk to us today about sexually transmitted infections, how to get tested in the city, as well as some of the other services that the Middlesex-London Health Unit offers.
A lot of students or people say STD versus STI. What's the difference? The difference is now that we call them STIs because it is more so an infection than a disease. So whether that is in fact a bacterial infection, a virus infection, even a parasite, it's an infection of the sexual organs more so than a disease that's causing you to feel unwell or sick and stuff like that.
Language is so important too, right?
Yeah.
So when you say infection, do you think that that switch happens because of treatment and the treatments that we offer folks around these infections?
Yeah, I feel like the language is very important because of medication and where technology is taking us. Whereas before in the past, it would have been crippling or there's no treatment or nothing like that for symptoms. But now with medication and stuff like that and what we know about these infections, there is so much treatment for it and so much education and so much information out there for people that it shouldn't be scary anymore because there are ways to treat them and it won't affect your life going forward. We test for chlamydia, gonorrhea, syphilis, HIV. We even do yeast infection, BV. We do herpes. We do hepatitis B and C. So we test for a huge array of STIs, and sometimes I feel like people don't know that. So when people do come to our clinic, they're kind of surprised that, oh, like I can get tested for all these things, and it's a very, very simple test. So
yeah, all in one spot, which is really nice.
The good thing about our clinic versus going to like a walk-in clinic is we actually do the testing on site. So whereas you go to walk-in clinic, you'd have to get a rec to go to public health labs to get the blood work done. We actually do the blood work and the urine samples at our clinic.
You said that you test for many things, but maybe giving us a snapshot of a few of those STIs and just a little bit of information about them.
Like I said, for chlamydia and gonorrhea, it's a urine sample. That's all we need. It's a little urine sample in a sample cup, and then you're good to go. Now for syphilis and HIV and Hep B and Hep C, yes, we do need blood work. However, at our clinic, if you don't want it or you don't feel comfortable in that moment of time, we're not going to force you. We understand. So therefore, if you want to come back maybe with a friend or with your parent or with your partner, where you've eaten some more food, come back and we'll definitely test you. That's not a problem for us at all. Even with herpes, there is some blood work. Not really accurate, but there is blood work. But if you do see a spot, we can definitely do some swabs as well. So there's so many different tests we can do for BV and bacterial vaginosis and stuff like that. We can also do swabs. We can definitely do swabs. So if someone does have discharge, we can swab you in the moment and kind of see exactly what's going on. We have microscopes in our clinic, which a lot of clinics don't have, so we can actually identify in that moment with your discharge what's going on.
Amazing. So it's like the one-stop shop for like your overall sexual
Exactly,
health.
exactly, definitely.
And I always say to students, you know, sexual health, like looking after your sexual health is part of looking after your overall health because it's a huge part of who we are and how we live our lives. And so I'm glad that you're here having this conversation because I think we need to break the stigma down around accessing these services and just building it in the way we would go to the dentist or the way we would go see our doctor for a checkup.
Yeah, I honestly, I love that. And that's one thing like we've seen as public health nurses, we've seen like there is a lot of stigma with STIs, and there's also a stigma of actually getting information. A lot of people aren't aware, and it's kind of sad. People are getting the information from Google. One thing I'll say to all students out there, please, 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 if you think you might have something, you have questions, Google is not your friend. I kid you not. You'll ask one question, you'll go down a rabbit hole, you'll go on Reddit, you go on, trust me, you go on Twitter. It's not your friend. We also have a thing where you can call the health unit. Okay. So you can easily call the health unit and you can say, I just want to talk to a public health nurse. We will answer any of your questions. I kid you not. I've been on the phone with people for half an hour because they're so stressed out. They went on Google said this thing, they went on Reddit, like there's so many things that the internet doesn't help you with. So just come to our clinic or just give us a phone call and then we'll kind of guide you to the right directions.
When folks come in and they're talking about when do I get tested or how often do I get tested, something that I always want to point out is one of the most common symptoms is no symptoms.
Exactly.
Yeah, because folks are like, well, I have no symptoms, I'm not feeling any different, so I probably don't need to get tested. Can you talk about what your recommendations are around when folks should get tested, how often?
Honestly, before every new partner, get tested. That way you kind of know what's going on with your body, you know what your partner's doing as well. And I would also say after every new partner. Things can happen in a relationship, you never know what's going on. You can be faithful, but you know what your partner's doing on their end. So getting tested after any kind of relationship is also very important. And if you are gonna be sexually active, just be responsible. So I have some clients who come see me honestly every 4 months. And I would say, honestly, I love seeing you, good for you, because you're being responsible, you're gonna be sexually active. I've had couples come as their date night, actually, come to see us, right? And I just chuckle with them. I say, and I thank them. I said, thank you for being so responsible and taking care of your body. It's as simple as asking your partner, when was the last time you got tested? That's a great way to start off. Hey, when was the last time you got tested? And if they said recently, you should feel open and comfortable to ask them, okay, can I get a copy of results? Just because at the end of the day, it is your body. And if you don't do your due diligence, then if there are things that happen to you because you didn't want to ask questions because you were scared, then if you do get an STI, and that sucks that much more when you could have taken that time, that 5-minute conversation in the beginning to see, hey, like, let's make sure everything's good. That way, you know I'm safe and you're safe as well. So if you're having sex, there's nothing to worry about.
Like you said, you want to see people often. It's not a bad thing to be coming into the health unit.
It's really not. Like, I tell you not, like, we are super chill at the health unit. It's very, very private, anonymous. No one's gonna know who you are. And listen, everyone who's in that clinic with you is getting tested for something similar too, right? So you shouldn't be embarrassed, because if you're gonna have sex, let's be responsible. So call us, make an appointment. So for STI specifically, we kind of try to capture like a huge array of time. So Mondays and Wednesdays, we are open in the evening. So 4:30 to 8 o'clock, 7:30, that's when we're open. And Fridays is Friday morning. So 8:30 to 10:30, 11, we're open as well. So that way we kind of see everyone who's working day shift or night shift, whatever it is, we can kind of accommodate you. So make an appointment. When you make the appointment, you call, hit 0. You'll be transferred to someone, one of our representatives, and then you'll say, I just want to make an appointment. They'll tell you the time, and that's it. So once you made that appointment, come by the health unit. So the health unit is located on King and Clarence, and come down the York entrance, okay? The York entrance. So it's also on the same side, if you know City Plaza, where the Good Life is.
Yeah.
On that same side, okay? So that's where you're gonna come in, the York entrance. Once you come in, you'll see on our big letters, Middlesex-London Health Unit. That's where the doors is, so you come in. The nice thing is we also have free parking. So I know parking downtown can be a hassle. So when you come in, if you say, yeah, I'm parking downtown, I parked, we'll give you a free voucher, you'll be good to go. And then you'll see our receptionist. You say, I'm here for my appointment. No one's gonna ask your name. And that's another good thing I forgot to mention, you don't need a health card. You don't need a health card, or for testing or treatment, no health card is needed. So it's a very, very simple sheet. All you're gonna need to fill out is your last name, your first name, your date of birth, your phone number, male, female, transgender, and that's about it. So once this is filled out, you give it to a receptionist, she'll give you a number, and then you sit down, wait for your number to be called, then you'll go with a nurse to the room, and then you sit down, talk to the nurse, talk about what's going on, the situation, and then you'll see a physician afterwards.
Okay, so this is what I come in,
yes.
This is what I'm gonna pee in,
yes.
And this is what I'm gonna then hand over at the end that's gonna be tested.
Exactly. So we have washrooms, obviously. So you,
well,
obviously, right? So we have the washroom. So honestly, we just need a little bit of urine. And what we'll ask is, don't pee before you come to the health unit. And I know for some tests, we want midstream. So like once you peed a little bit, we actually want the initial urine. So the second it comes out, that's the urine that has the best accurate testing. So that's the pee cup you're gonna fill out. And then a lot of people who are afraid of blood work, it's not that much blood. It's just gonna fill this up a little bit halfway. That's all the blood we're gonna need from you, okay? So once the doctor fills out the blood, does this, you're good to go. Our doctors are amazing. This is what they do every single week, so they're really, really good at it, so yeah.
Okay, so I came in, I got tested, and what happens next in terms of contact from the health unit?
So what happens is afterwards, our turnaround is 7 days, so we say a week. So we'll know the results within a week, and then our motto is no news is good news. So if we don't call you, you're good, don't worry about it. Okay, but for those who are anxious like I am, or who are very paranoid, feel free to call us. We will definitely give you the results over the phone, as well as if you want, we can also give you a hard copy. So that way you have a hard copy. Therefore, if you have a sneaky link in the future you want to, have sex with, you have a copy, say, yes, I got tested, these are my results. Therefore, you can ask your partner to do the same thing because you've done your due diligence. It's only fair that they do it as well. So that's an option as well. But for those who are positive, okay, so for example, say if someone's positive for chlamydia or gonorrhea, we'd call them, say, hey, listen, you're positive for whatever STI it is, come back to the health unit, we'll treat you, and then go about your business. But we do ask that you either notify your partners or we'll notify your partners on your behalf. So if you feel comfortable, go ahead and notify your partners. If you don't, however, we can notify the partners on your behalf. So we'll ask for the number and we'll call all your partners, okay? For those who do feel anxious and don't feel comfortable with that because of whatever the reason may be, we totally understand there can be some circumstances why you don't feel comfortable notifying your partners. We can get different health units to actually call and say, hey, for example, get a health unit from Lambton County. Say, hey, you've been in close contact of whatever STI may be, get tested. That way that partner has no idea where it's coming from because it's a different county, different health unit, so they have no idea where, they can't trace back the source of the STI, which is a great aspect that we have. So that's one of the units, that's one of the services that we have that I love so much.
And so the emergency contraceptives, some of them have some timelines on them too, right?
That's true, yes.
Yep, so do you mind talking about that?
Yeah, definitely. So with Plan B, all emergency contraceptives, they're most effective within the first 3 days, okay? So especially Plan B, within the first 72 hours, that's when it's the most effective. But each day you wait, it's a little less and less and less effective, okay? So up to 5 days, it's less effective on the 5th day for Plan B specifically. Now for Ella seems to be more effective even past the 3 days like Plan B. So even on the 4th day and the 5th day, its effectiveness is a lot more. And copper IUDs are super effective. You can give it past the 5 days and you just have an IUD inserted through our clinic as well, so yeah.
So I know timelines, sometimes we don't always remember.
Yes.
So I always want to bring it back that if students ever have any questions, if something does happen that you're worried about, you're worried that you've become pregnant or you're worried about anything related to your sexual health, they can just call the health unit and ask these questions.
Yes, definitely. And then we've also had clients, so for talking just about Plan B or anything emergency contraceptives, you don't need an appointment at all. We do have a pill window in our clinic, so you can always, it sounds silly, but it's literally a doorbell. So you hit the doorbell and it sounds in the back, so the nurses know.
Yeah.
We'll come to the window and answer all your questions. And if you need the Plan B or whatever needs, or just talk about certain things, or kind of want resources, we can definitely give it to you right there in that moment as well.
Great. And so for some of our students that are coming from out of town or out of country and they don't have their family doctor here, they can come and get the prescription at the health unit for birth control and then also get the pills or whatever method they're getting same day.
Yeah. And then one thing I will say is for those who do have a health card, and if you're under the age of 25 years old, there's something called OHIP Plus, right? So for those individuals, birth control is covered for you up until the age of 25 years old. So if that's something you're thinking about, or even IUDs are covered as well. So if that's maybe an option that's stressing you out, the financial aspect of it, if you do have a health card, that is covered for you. One of the biggest things that people don't kind of realize is that there's no symptoms, especially for STIs, there's no symptoms. So I can't tell you how many times, honestly, I've had people say, oh, like I'm just getting tested just for peace of mind. And then they come back the following week, I had chlamydia, I had no idea. Don't know how long I've had it for, but I had chlamydia. So that's one thing where we educate and people are like, really? Yeah, I'm like, yeah, there's a lot of times you don't have it. So, and then you're sitting with an STI, you don't know it. You're having sex with other people and then potentially spreading across. So that's one thing. Also, with stuff like HIV and herpes, that's a big thing where people are very, very scared to talk about. Honestly, there's so much information and technology and things out there for those individuals that shouldn't be a hindrance anymore. And if you have any questions, please talk to the health unit about that, because you shouldn't be alone, because there's so many resources that we can provide for you. And lastly, with emergency contraceptives, so like Plan B and L and things like that, you can also have your partners come and pick it up for you as well. Right? So say you have class, you still need the Plan B, your partner can definitely pick it up on your behalf, and we can definitely give it to your partner. Or if you want to pick up your birth control, if you're busy and your partner can pick it up for you, we can definitely give it to your partner on your behalf to pick it up for you as well.
I love
Yeah,
that.
so
I did not know that.
Right? Exactly.
Yeah, I am learning too. A lot of students come in, and not only are they maybe afraid of going to get tested, but then they're afraid of, oh, if I get that positive result, what does that mean? Or, and you really wonderfully explained about how you contact them, but could you talk a little bit about what treatment might look like?
Yeah, definitely. And that's one thing it's kind of sad with people don't know is like most STIs are treatable. Some are curable, yes, and some we can just treat the symptoms. So for specifically chlamydia and gonorrhea, antibiotics. Honestly, it's just antibiotics. You take the antibiotics, so what happens is you take the antibiotics for the duration of time, depending on what you have, and then you wait 7 days. So no sex, no sexual activity for 7 days, period, okay? And then after that, you're free to go. And now if you're one of the people who have symptoms and the symptoms are kind of still lingering, come back. You might just need an extra dose of antibiotics, okay? That's totally fine, that happens a lot. So you give an extra dose of whatever treatment that you're taking, or a new medication that works better for your body. And then so wait 7 days. After 7 days, you can go back to having sex like nothing happened, okay? Now, if you want to get retested to agree treatment, we do that as well. Now, we recommend you come after 4 to 6 weeks. Why? Because if you came a little earlier, you can have a false positive test. So the medication still needs time, your body needs time to actually clear the bacteria, whatever's going in your body. It takes a little bit of time, so come back after 4 to 6 weeks, get retested to make sure everything's clear, okay? So that's also, and then with syphilis, because actually, you mentioned chlamydia and gonorrhea. The funny thing is, syphilis right now in London specifically is on the rise. Okay? And it's something that's we are kind of monitoring as a health unit to kind of see what's going on. So, but that as well is treated through antibiotics as well. Okay, so a lot of it is treated by antibiotics, and those stuff that aren't treated by antibiotics, we can treat the symptoms, and we can kind of manage the symptoms as well. So those are things as well. And even STIs as scary, or as people might think as HIV and syphilis, or as HIV and herpes, there's things you can do for them as well that a lot of people don't have information about. So if you are someone who's kind of cares about that, what you can do for HIV or stuff like that, call the health unit and we'll kind of guide you in the right direction. And that's another thing we also offer is PrEP. Okay, so PrEP is for those individuals, it's pre-exposure prophylaxis. Okay, so what that means is for those individuals who are potentially at high risk for getting HIV, whether through sexual activity or who your partners are, you can actually take the medication and it will bring down your likelihood of getting HIV, even if your partner is positive. Okay, so that protects your body as well. But a lot of people don't know that we have that kind of medication. So that's another thing we do have at the health unit as well. We also do vaccines. So to protect specifically Gardasil, to protect against HPV. It's a virus, it's a viral infection. So what happens is, when you hear about it in the community, it can lead to cervical cancer. Okay, and I think there's 2 or 3 strands specifically that can lead to cervical cancer. Most of the times, if you do have HPV, it will lead to like some kind of warts or bumps that you can get. Now the treatment for that is very, very simple. It's called cryotherapy. So literally what it does is we just freeze it off, and it kind of gets rid of the warts on your body. But if you just don't mind having it there, within time it will kind of go away on its own. But because it can look unpleasant to look at, you see warts on your body, we can do treatment for you as well. But now, I don't know about you, but when I was going to school, I'm a little older, obviously. It started off when I was in grade 8. So, and it was back when, back when only females were getting it.
Yeah.
Okay, so males weren't getting it.
At the time, it was only, yeah,
females too. So like, me specifically, I didn't get that Gardasil vaccine because it wasn't available to me. But I know now, I'm in grade 7, grade 8, males and females are being getting this vaccine as well. So it does protect against HPV. But we do have it as well in our clinic. And we do have vaccines for Hep B as well.
Okay, so you have testing around STIs
Yes.
and treatment.
Yes.
You have the birth control clinic where you're providing prescription and information and education, helping people find what's the best method for them, as well as emergency contraceptives.
Correct.
And then you also have the vaccine clinic where folks can get vaccinated against HPV.
Yes.
Okay.
And then we also do, I'm telling you, we do everything.
No, keep going.
It's called, it's something that's relatively new. It's called our needle exchange program. Okay. So what it is for those individuals who we understand that there are some individuals who are using drugs.
Yeah.
Okay. We're not here to judge them, whatever the circumstances may be, but they're still using, and they're not in the space where they can not use anymore. Okay, they're still in that space. So what we do is we have like a huge room, and we just have supplies, clean supplies. So if you want your needles, you want bowl pipes, you want cookers, you want foils, anything you might need for your drug use, we have it there. And our rationale behind it is we rather have you use cleanly, that way you protect your body against spread of certain diseases, STIs as well. And that way, once you are ready to quit using, you'll be a lot safer. And then you'll be a lot ahead, and then that way your health won't be nearly as bad. Because the sad truth is there are people who are reusing needles. There are people who are reusing bowl pipes or cookers and stuff like that. Yeah. And you're just increasing the risk of spreading diseases amongst that population, right? So we want to kind of protect them as well. So we do have a needle exchange program as well. And I kid you not, we see tens of thousands of clients a year. And yeah, we're really proud of it. And it's kind of more of a harm reduction method that we have in the community. And lastly, condoms. Listen, please, 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 if you have condoms, if you need condoms, we have so many.
So do we, actually.
Listen, please,
so do we, and dental dams.
Preach, yes, dental dams. That's interesting, because a lot of, even shoppers doesn't have dental dams.
They don't, and I'm going to do a plug. I'm going to do a quick plug.
Okay, go ahead.
We have sexual health vending machines on campus. We have one outside the cafeteria, so outside of Oasis there, and then we have one in the Falcon House lobby. So for students that don't know, these sexual health vending machines provide condoms, dental dams, pregnancy tests, and other pharmacy items at cost to students, as well as reusable menstrual cups and pads. So if you need something in a pinch, we recommend that you use the machines because they're there for you 24/7, and the cost of them is also significantly lower than if you were to go to a pharmacy like a Shoppers. And that's when we're not open. But if you obviously need sexual health products during the day and you don't want to have to pay through the machine, you can also contact the counseling office, and we can make sure that we put a bag of stuff together for you, or go see Darryl at the health unit.
Wow, that's crazy. Wow. One thing we hear is, oh, I'm on birth control, I don't need condoms. Yeah, you do. Okay, yeah, you do. That's fine, you're on birth control and that protects against pregnancy, but that won't protect you against an STI. There's a number of reasons why condoms might break, so we also do a lot of education around why condoms might break. I can go through a whole lesson about that.
We'll have you back another time.
We have a whole episode about that specifically.
Okay,
but yeah, it's just more so like making sure that you're staying safe. Okay, that's the biggest thing, like harm reduction as well. And there's so many different STIs out there people don't know about, or if you don't have that knowledge. So therefore, the best thing is make sure that you're safe that way. Afterwards, I kid you not, Leah, I've had students say, I can't even do my exams because I'm so stressed out.
Yeah.
I feel their pain. It's like, it's exams, but I can't study, I can't go to the club, I can't go to the bar, I can't even go to the gym because I might have an STI.
Yeah.
So like, those are the things where we just want to do it for your mental health as well.
Yeah, absolutely.
Right? Especially as a student, there's so much stress you have on your life already. If we can eliminate this stressor, so that way you can focus on your school and your career and what you have going on in your family and your loved ones, we want to help you do that.
So something that we ask every guest is, what is your favorite food?
So right now, my favorite food would have to be sushi. I'm a big, big sushi guy right now, yeah.
And favorite spot in the city to go for sushi?
Good questions. I would have to recommend, if I had to recommend any places, would be Mikado Sushi and Plaza Sushi. Those are my go-to places for sushi right now. Yeah.
Yeah, and if I'm not mistaken, for our regional campus in St. Thomas, there is a Plaza Sushi, I think, in St. Thomas as well. So those students don't have to come all the way into the
Y'all
city.
lucky.
So
Y'all
yeah,
are lucky.
yeah.
Yeah.
Thank you for those recommendations.
My pleasure. My
Appreciate
pleasure.
it.
Anytime.
Well, thank you so much
pleasure,
for coming
my
and blessing us
pleasure.
with all this amazing information.
Thank you.
I know for our students that there's probably always follow-up questions, so we are going to direct you to just reach out to the health unit
Yes,
directly if
yes.
you want to know more. This is just a good starting point to know where they're located and some of the services that they provide. We so appreciate you coming in.
Thank you. I
Thank you so
appreciate it.
much.
Thank you. Yeah, definitely.